Hamilton Mayor Fred Eisenberger joins us this morning with an update on the vaccination situation in the city. Good morning.
Good morning. Happy Monday.
Happy Monday to you. So can you give us an update on the city's new mandatory vaccine policy that was voted on last week?
Yes, thanks for the question. And yes, it's an important policy, I think, going forward. And I'm hopeful that the province of Ontario reinforces that with a policy that we can all follow, which I sense may very well be happening.
Could happen tomorrow, yeah.
In the meantime, we've put our own policy into effect that requires mandatory vaccination verification. And the only justification for saying now would be a human rights issue or a medical issue. And if one fails to demonstrate those two issues and just refuses, then there's an education process and hopefully an opportunity for them to understand better why vaccinations are more valuable for them than not taking the vaccination. So we're going through a process. We're not looking to have anyone lose their job. What we want is compliance, and we want people to get a good understanding of how many in our employ have been vaccinated so that we can better protect them and the people they interact with in our broader community and their families.
Okay, so this is for municipal employees. What about at city-run venues?
Yeah, yet to be determined, and that I think the province may very well come forward with a policy that will impact that. That's certainly they've indicated that they're heading down that road, and I hope they do. That will give greater clearance for all municipalities, quite frankly, on what to do and how to treat those issues. I think if in the absence of that, there is a consideration of whether or not contractors that work for us need to follow that policy. That hasn't yet been determined. Or whether or not folks that are visiting our facilities need to be vaccinated and demonstrate that. So that's still an open question, and I'm hopeful that the provincial guidelines will help clear that up.
Okay, and we really have to get those vaccination numbers up and the push for that, especially because so many new people are coming into the city because MAC has opened up its campus now, so students are slowly moving in over the next week or so.
Yeah, they are, and McMaster was one of the first to indicate that they required full vaccination for anyone that's visiting their campus. So if you're in residence or you're going to the campus at all, you're working at McMaster, you are required to get double-dose vaccine, which is a good thing, and that certainly adds a level of protection for those that are interacting in the broader community as they go to restaurants and get their books at various bookstores or come downtown. That interaction from the McMaster perspective provides a higher level of protection for everyone that comes into contact with the campus. That's a good thing. Mohawk College is on the same path. Mm-hmm. And I would like to think that the other universities, Redeemer and Columbia College, will do the same. That really then provides a level of protection for the individual students and teachers, but also for the broader community they interact with.
Right, and speaking of the broader community, Hamilton has one of the worst cases per capita in Ontario. Hamilton and Windsor, the highest number of cases. So anything being done, or are we looking at smaller pop-up clinics again?
Yeah, exactly. That's exactly the strategy that we're employing. We've got the vaccination bus that's visiting Hamilton on a regular basis. The Ottawa Street Parkette will have a mobile clinic. That happened yesterday on Ottawa Street North near Edinburgh. So pop-up clinics is really the effort to try and get to areas where vaccination rates are a little bit lower than they are in other areas. So pockets in Flamborough, in and around the Red Hill Creek area in the East End, some downtown locations, even some locations on the mountain. Where vaccination rates are low. We're going to continue to provide pop-up clinics as well as walk-in opportunities for those vaccination clinics that are still operating, that people can just walk in and get a vaccine. And so it's easier than ever for people to get vaccinated, and now more important than ever, given the rise of the Delta variants and what we want to get to, which is not having to worry about all the masking measures and the vaccination rates, that hopefully we get enough people vaccinated that we can get to a better sense of normalcy in our entire community.
Okay, want to move on now from COVID to the election campaign. We've had all three major party leaders really focus on Hamilton. Why do you think that is?
Well, what's not to love about Hamilton? I mean, why wouldn't you
Exactly.
come to Hamilton? I mean, for starters, but look, they all have seats here. You know, two Liberal seats, two NDP seats, one Conservative seats. Three of those seats are not being sought by incumbents, so they're considered to be open seats. And I would think that all the parties are interested in not only holding on to what they already have, but gaining more. And so Hamilton becomes, I think, a prime target for that. Hamilton has been diverse politically for quite some time. It used to be that the whole area was liberal red in the Chrétien years, and then prior to that, it was predominantly conservative blue. Now we have a mix of two liberal, two NDP, and one conservative seats, and I'm sure that the party leaders would very, very much want to
Hmm.
hang on to those seats, and if they can, steal one or capture one from one of the other parties. So
Okay.
Hamilton becomes a pretty important target, I think, in terms of maintaining the status that they have right now.
We will find out after September 20th. Thank you very much, Mayor Fred Eisenberger from the City of Hamilton.
Thank you, Annette. Have a great day.
You too.